if you're kind of starved for context, you can like kind of chat with Claude about a presentation style that you're interested in making and just brainstorm there. Say, hey, for me, for example, I've got a presentation that I've got to give this next week on the ethics as they relate to orthopedic surgery. I'm going to speak about something having to do with AI. I've got a presentation that I have to give at a lecture on the ethics of artificial intelligence, but sort of discussing the potentials and pitfalls of that. The audience is a group of orthopedic surgery residents. I need you to come up with a few different topic ideas. And from there, we're going to make a PowerPoint presentation for that. That's going to be Duke Ramen. This is like if you're starved for context. I know I've got a lot of clinicians here. If you were on one of my other Substack lives, you'll see that I use open evidence often to create context. Say I've got to give a presentation on secondary fractures, rates after initial fractures. So whenever you break a bone, if you have osteoporosis, there's a risk of you falling again and breaking another bone, just for context. I'll come in to open evidence. This is a free tool for clinicians. I'll click this deep consult button. If you're not familiar with it, you just click it. It's right here. I think a lot of people use this to ask one-off questions. I totally use this for research. I'm going to be giving a presentation on factors that contribute to secondary fractures in patients in older adults. And some of my focus is going to be on the evidence for different treatment options and intervention to prevent secondary fractures, specifically in fragility fracture patients with an emphasis on hip fractures. Go ahead and please make that report for me. Make sure it's evidence-based. Keep in mind that I'm going to use this to educate others on potential recommendations for secondary fracture prevention, including potentially a fracture liaison program or exercise, and I need all the evidence around that. If you haven't used this deep consult feature, it's fantastic. If you happen to be a clinician and have access, it's going to ask me a few questions here. I can skip them if I want, but I'm not going to. Says, are you interested in evidence for secondary fracture prevention interventions for all older adults or only those with prior hip fractures? I'll just answer these here. I'm interested in evidence for secondary fracture prevention in all adults, but I want an emphasis on prior hip fracture patients. The report can include some of the pharmacologic intervention evidence. Yes, I'm very interested in that. But I want to have both. The data on the effectiveness of the fracture liaison services should be included, but other coordinated care models would be reasonable. I do need to make an economic case for secondary fracture prevention because I'm giving this presentation through the lens of value-based care. So please make sure that you include that as well. And my focus is in the United States. All of this is just context I'm giving, right? I'm going to have this really nicely generated long report. We'll come back to this, okay? There's other ways to make PowerPoints using AI. First off, we'll come here, right? These are the images that were created. It's got my name, wrong degree, but that's okay. Usually pretty accurate. Let's say you don't like this style. You can just